Hi guys, once again I'm meeting you to continue the lesson what we talked about the last session. Locomotion movement. So I mentioned about three components are involved in locomotion as well as movement. One, the muscular system, what is studied so far. The second one, that is the skeletal system, and both being coordinated by the nervous system. We have studied already. Now let's go further about the skeletal system. What are the components of the skeletal system, etc. The skeletal system. So it mainly consists of the framework of, that one, the different types of bones and cartilages. The main difference between the cartilage and bones, that one, the bones are calcified. And in the case of cartilages, the calcification is absent. That's why it's soft in nature. For example, the earlobe, the tip of the nose, the epiglottis, the eustachian tube, all being made up of cartilaginous bones. They are devoid of, that is calcium. That's why they are flexible. But the real bones, the calcified bones, are with the deposition of calcium phosphate and calcium carbonate. Nearly 80% of the bones are formed of calcium phosphate. The remaining 20% is being formed of calcium carbonate and some others. Anyway, now the bones and cartilages are considered as the framework of the body. They are nothing but specialized connective tissues. Specialized connective tissues meant for locomotion. Now, I mentioned about we have a basic substance, what is called the matrix. In the case of bones, the matrix is very hard. This is because of the deposition of calcium salts, what I mentioned. There is calcium phosphate of 80% and calcium carbonate just nearly about 20%. And when compared to this bone, the cartilage has slightly pliable, meaning for that one flexible. So the matrix is actually, that is, doesn't contain calcium but contain organic salt, chondroitin sulfate. Chondroitin sulfate, this is an organic salt present in the cartilage, supporting the cartilage bones. That's why it's somewhat actually strong but not actually rigid. Now the total number of bones, as you studied in your earlier classes, 206 bones. All the 206 bones are together form the framework of the body. So the entire skeletal system forming the endoskeleton is being divided into one axial skeleton and appendicular skeleton. An axial skeleton of 80 bones and appendicular skeleton of, you see that one, 126 bones. Now what are the components of axial skeleton, which include 80 bones? One, the skull, which is being formed of 22 bones, which include both the cranium and also we have the face. And hyoid bone, the one which is supporting what we have the tongue. Just below the tongue we have a horse-shaped bone, what is called the hyoid bone. And then the vertebral column in adult is being formed of 26 bones. Then we have the rib bones of 12 pairs. In addition, we have the breastbone, the sternum. And also we have the ear region, the middle ear, we have ear ossicles. A chain of 3 bones responsible for the conduction of the vibrations from the vibrating body, namely tympanum, towards what we call the internal ear, or what we can say the oval window. So anyway, now it's being formed of 22 skull bones, hyoid bone 1, ear ossicle 6, and then we have the vertebral column 26, the ribs 24, and then sternum 1. And the appendicular skeleton, which forms the ball, the frame to which what we have, just actually, and which form the frame or what we have the appendages for the movement. They are being connected to the axial skeleton, which includes mainly the girdles and also the limbs. So we have upper limb, lower limb. Each upper limb and lower limb is being formed of 30 bones. So altogether 120 bones together form the limb skeleton. 120 bones together form the limb skeleton, which includes the forelimbs of 60 bones, the hind limbs of 60 bones. Then the girdles, to which the limb skeleton is attached. Altogether we have 6 bones. Just 4 bones forming the pectoral girdle and 2 bones forming what is called the pelvic girdle. Pectoral girdle is being formed of 4 bones, 2 on either side. The pelvic girdle is formed of 2 bones, 1 on either side. Let's see one by one all these skeletal structures. Now let's take the axial skeleton. First on the skull. Human skull is called dicondylate skull. The animal kingdom in amphibians and that is mammals alone have dicondylate skull. The meaning for that one, We have two occipital condyles present at the base of the occipital bone. Concerned with articulation, we can rotate the head in three directions. This is because of the condyles present in the occipital bone of the skull. So in the case of amphibians like frogs and human beings, including all the mammals, the skull is dicondylic, having two occipital condyles. Whereas in the case of fishes, in the case of birds and reptiles, the skull is called monocondylic skull, monocondylic, having only one occipital condyle, monocondylic skull. In the case of reptiles, birds, and also in the case of fishes, amphibians and mammals have dicondylic skull. Now what are the bones of the skull? It's a very simple one, just we have to go only the names of the bones. Now the skull is being formed up, I mentioned about the cranium or the brain box of 8 bones. So out of the 8 bones, 2 bones are normally actually found in pairs. The remaining bones are found in singles. Now we have the frontal bone at the front side, the frontal bone. The parietals forming the roof of the cranium. Then occipital, the base. The basal region is formed of occipital. And then lately we have 2 temporals. And sphenoid bone extending from one region to another region. That is from one side of the skull to another side of the skull. Just slightly above what we have, the earlobe region. So this is actually a butterfly shaped bone. The butterfly shaped bone. The bone is more or less butterfly shaped. And the ethmoid, the one you could see only in the eye orbit. It is extending from one eye orbit to another eye orbit. Very small bone. Sphenoid extending, just actually passing through the skull from one side to another side, from lateral side to the lateral side. And that is also called butterfly shaped sphenoid bone. The face is formed of 14 bones. Now in the case of cranium, all the bones are firmly fixed. They do not exhibit any movement. That's why they're called as actually immovable bones. The joints between these bones are called the sutures. A zigzag line in the form of joint is present between the bones. That is called as a suture. And now let's go for the face. In the face region, we have 14 bones. Out of the 14 bones, one bone is the only movable bone, what we have, the lower jaw. All of the bones are actually fixed, not movable. So the only movable bone of the skull is what is called the lower jaw bone. That is called mandible, the strongest bone, we can say the strongest bone. Now what are the 14 bones? Now we have the nasal bones. So the nasal regions, we have 2 bones, a pair of bones. Then lacrimals, they are present towards the inner corner of the eye, they are 2 in number. Then zygomatic bones, these are all the cheekbones. These are all the cheekbones. So these are all the elevated bones, the cheekbones. Then maxillae, it is being formed of 2 bones. They are nothing but actually the upper jaw bones. The upper jaw is formed of 2 bones, maxillae. Then the roof of the buccal cavity is being formed of 2 bones, what are called the palatines, is forming the roof. And then inferior nasal conge, that is nothing but what we have is scroll-like bones, present just the inner nasal cavity, scroll-like bone, like this, scroll-like bone, present the inner nasal cavity. And there is one omer, a single omer, separating the nasal passage into 2. And I mentioned already, only movable bone in the skull is nothing but the mandible. I mentioned what is the strongest of all the bones. And the only movable bone of the total skull, 22 bones. So these are all the bones. We have to know only the names of the bones only, not necessarily about the descriptive aspect. But you have to know some nicknames for certain bones. Okay, the movable bone of the skull, and then the butterfly shaped bone, like that you have to know some questions, eccentric questions. Now hyoid. So 22 skull bones, now hyoid. So it is otherwise called as a tongue bone present just below the tongue region, supporting the tongue. It is more or less what is called U-shaped bone, single in nature, or horseshoe shaped bone, supporting what is called the tongue, present at the base of the tongue. Just normally at the base of the buccal cavity too, we can say. Now in the ear ossicles, the middle ear has 3 bones, a chain of 3 bones, namely malleus, incus and stapes. Malleus, incus and stapes. They are connected to what is called actually the tympanum on one end, and then what is called the oral window at another end, responsible for conducting the sound vibrations. Of these 3 ear ossicles, Now, the smallest bone of the whole body is what is called the stapes. So, we have malleus, incus and stapes. Malleus, hammer-shaped bone. Incus, what is called anvil-shaped bone. And then the stapes is stirrup-shaped, that is the smallest bone in the body. Smallest bone in the body. All these three bones collectively called as ear ossicles. Now, the skull region I mentioned articulates with the superior region of the vertebral column. That is namely what we have just the axis bone, because the axis bone is the second vertebra and the atlas is the first. So now the skull is normally placed over the atlas. The atlas is being placed over the what is called the axis, allowing the movement in three different directions. So the occipital bone, at the base of the occipital bone we have two condyles, and normally there is a large opening also present at the base of occipital bone, what is called foramen magnum. Foramen magnum is the largest opening present at the base of the occipital bone, and through which only we have the spinal cord is continuing from what is called the hindbrain, the medulla oblongata. And now on one and either side of this occipital bone only we have the condyles, namely occipital condyles, and they are responsible for the movement. Now this is a lateral view. You can see that one frontal, and you can see that one that is what is called the parietal bone forming the roof. Then it is occipital. Here only we have two condyles, you could see later now, and this is what is called the sphenoid bone and lacrimal bone, all being placed inside. And this is what we have a temporal bone, paranature present on either side. But the sphenoid and ethmoid are normally, we can say, single bones, like that the lacrimal, etc. The only mobile bone in the skull is nothing but the mandible. So the mental foramen referring to what is called the opening for the passage of, that is, blood vessels. Now this is what I mentioned, the foramen magnum, the largest opening. And then we have just actually two processes. Just what we get the condyles. These are the two condyles, occipital condyles. They are placed over the atlas, and the atlas being placed over the axis, allowing the movement. So we have also the one with the single bone separating the nasal cavity into two, and then we have the temporal bone, just what we get the zygomatic process. This is nothing but the process formed by the zygomatic bone, or what we have, that is the cheekbones. Other things we have to know. Listen to the diagram, the picture. Now vertebral column. Now in the case of newborn children or newborn infants, there are 36 single pieces of bones called vertebrae, all joined together to form what is called a long chain of bones, namely the vertebral column. But in the case of adult, such 33 bones are not available because of the fusion of certain bones at the posterior end, leading to the formation of only 26 bones. So totally in adult we have 26 vertebrae, but in the case of young one, the newborn one, or during development, we have 33. So I mentioned already, it is formed of just 26 bones in adults. They are arranged serially one above the other, and that constitutes what's called the vertebral column. And the vertebral column exhibits 4 curves in different regions. One in the neck region, what is called cervical, another one in the thoracic region, another one in the abdominal lumbar region, and finally the pelvic region. That is also, we can say, the sacral region. So we have 4 curves: cervical, thoracic, lumbar, and then what we have, the pelvic regions. And if you study what we have, a single vertebra, each vertebra has a central body. You can see while touching the back side, you can find some nodal-like structure, that is nothing but the centrum, which encloses a space what is called the neural space. When the bones are arranged one above the other, a continuous canal being formed, that is called the neural canal of the vertebral column, through which only the spinal cord passes. Now, the entire vertebral column is being divided into 5 distinct regions. What we have: cervical region, thoracic region, lumbar region, sacral region, and then coccygeal region. Now the cervical region is formed of 7 vertebrae. It is constant for all the mammals, but we have some exceptions. So the number of vertebrae in all the mammals is equal to 7. Cervical vertebra, the number of cervical vertebrae. But we have some differences in the case of 3-toed sloth, or that is actually 2-toed sloth, or in the case of manatee, we have the number being reduced, or in the case of ant, bear, I'll tell you now, I'll show that. So anyway, even the case of one person came related to, that is a camel or giraffe. So even the case of camel and giraffe too, though the neck is longer, they do have only 7 vertebrae. But the length of the neck is more how? So between the vertebrae we have some bonical plates are present to increase the length of the camel neck or the giraffe neck. But in the case of camel too or in the case of giraffe too, though they have a long neck, the number of vertebrae only, that is 7. But exceptions, I will show that one. In the case of two-toed sloth, I mentioned here, just some, you see that one, these are all just some mammals. So two-toed sloth, and in the case of manatee, this is what is called commonly called a sea cow. They have only 6 vertebrae in the neck region, 6 cervical vertebrae. In the case of ant bear, the number of neck vertebrae 8. In the case of three-toed sloth, the number of vertebrae, that is 9 in nature. These are all the 3 exceptions. In all other cases, we have just the number of cervical vertebrae is only 7. No change, including camel and giraffe. Then, so we have 7 cervical vertebrae and there's 12 thoracic vertebrae, and that is what we have in the lumbar region. That is what we have the lumbar vertebra. Of all the vertebrae, the largest and strongest vertebrae, what we have the lumbar vertebrae. The longest and then, the largest and strongest. Even also heavy in nature. Now the sacral vertebrae, that is being formed of 5 vertebrae in young ones, but fused together to form a single plate, what is called sacrum. That's why we have, that is only 26. And now the last one, the coccygeal vertebra, that is one in nature, that is being formed with the fusion of 4 vertebrae. Fusion of 4 vertebrae. That's why we say it in young ones 33, but in the case of adult we have 1 sacrum, 1 coccyx, representing the vestigial tail. As in the case of, you see that one our ancestors, we have a long tail, but here in our case the tail is vestigial, non-functional, having only 1 coccyx vertebra formed with the fusion of 4 tail vertebrae. So I mentioned already the number of vertebrae, cervical now constant, but in the case of the 3 animals, what I mentioned, 3 groups we have only, that is the number has been changed from 7 to 6 or 8 or 9. Now the first cervical vertebra is called as atlas, bearing what is called the skull. The second vertebra is called what is known as axis. What is the peculiar condition of the atlas? It doesn't have the body, namely the centrum. So centrum is absent in the case of that is atlas. Atlas without centrum, no centrum. And the second vertebra is called axis. It is having a process what is called odontoid process. Odontoid process, a peg-like structure on which being rested what we call the atlas, on which is rested what we have the skull for the movement. So this is like a pivot joint, just like a seesaw. So pivot joint. So the atlas and axis represents what we have a pivot joint, on which only the skull is normally rotating. So odontoid process is present in the case of second vertebra, and the centrum is absent in the case of first vertebra. Now this is the vertebral column. You can see the cervical region, the thoracic region, the lumbar region, the sacrum, a single piece of bone, but formed with the fusion of 5. And then coccyx, formed with the fusion of what is called actually 4. Now this is a single typical vertebra, that is a lumbar vertebra, the largest one, the heaviest one, and also that is we can see that is place the strongest one too, largest, strongest, and also you can see the heaviest one. And whenever we are talking about the study of vertebra, we are talking about only the lumbar vertebra. So it is the body of vertebra, that is what is called the centrum, which encloses an arch. So there is an arch, what is called neural arch, which encloses what is called a canal, that is called the neural space or the neural canal. Lately we have 2 processes, what is called the transverse processes, and also we have the articulating facet, the meaning for that one, the region for articulation. The successive vertebrae are actually articulating with one another by means of this what is called some cavities. They are called articulating faces. Zygopophysis, normally we can say zygopophysis, the technical word. And we have actually a backwardly directed spine, dorsally what is known as a neural spine. Now this is the neural spine. So what we are observing while touching the back side, the vertebral column, nothing but what we call the centrum only, not any of the structures. Now this is a similar organization of the vertebra. Once again the same picture. So this is the lateral view. Likewise the vertebral column being formed by the arrangement of the bones like a pile of coins. This is the centrum, we see that one. This is formally directed, the processes and then spines, etc. We have articulating facet for the articulation for upper side and lower side. They are called as lygopophyses but not mentioned here. So we have inferior articulating facet for articulation of the lower vertebra and then superior articulating facet for the articulation, the one which is like above this vertebra. So likewise the movement is possible, and in between the what is called the vertebrae we have what is called the plates, intervertebral disc formed of fibrous cartilage, intervertebral disc between what is called the vertebrae to act as a cushion, preventing the friction while we are bending what we have the body. The friction being made, that is being prevented by means of what is called the cushion formed of what is called the fibrous cartilage, normally called as intervertebral disc, the one which is formed in between the vertebrae, formed of fibrous cartilage. Now this is the first vertebra atlas. I mentioned there is no centrum. This is the articulating facet on which only the contrails of the skull being placed. Now this is the peg-like process, what is known as a odontoid process found in the case of axis. Simply we can say C1, C2, C3 like that, nothing but actually cervical, T1, T2 like that, what we have thoracic. We are using the first letter of what we have the region. Now the peg-like process, now it is being placed over it. Now this is the articulating surface. So atlas is articulating on axis and the skull is acting on atlas. Now slip disc. What is the meaning of slip disc? Sometimes what is happening, the displacement of the vertebra from its original position occurs. This is due to the displacement or the degeneration of the intervertebral disc. Sometimes what will happen, the degeneration of the intervertebral disc occurs. That results in what we call the displacement of the vertebra. And that is called slip disc. That is called slip disc. Because of the degeneration. Because of sometimes you have the cervical spondylitis. Cervical spondylitis, you can find the people are wearing some neck collar. And the collar is keep what we have just a protection to the bones, the vertebral bones in the cervical region. Because of the degeneration of the intervertebral disc, people have some problems, and that is called spondylitis. And that is happening because of the degeneration of the intervertebral disc. So when there is a degeneration of the intervertebral disc, now the displacement of the vertebra occurs from its original position, and that is called slip disc. Now the next one, axial skeleton ribs. Now in human beings we have 12, so we can say what is called the thoracic cage. The thoracic cage is formed of, you see that one, 12 pairs of ribs and a single chest bone, what is called, that is the sternum. Now in our body there are 12 pairs of ribs. These 12 pairs of ribs are connected to what is called the vertebrae, and they are what is called the dorsal region. Dorsally they are connected to the vertebral column. Ventrally they are connected to the sternum, either directly or indirectly. Now at the dorsal side, the rib is normally having two heads. Such a head is called bicephalic head. So the ribs are bicephalic in human beings. The reason for that one, they have two heads at the posterior end. Dorsally they are connected to the vertebral column. Thus actually the 12 pairs of ribs are connected to the 12 ribs, the 12 vertebrae of the thoracic region, otherwise called the thoracic vertebrae. Now anteriorly they are connected to the sternum and the rib bone, either directly or indirectly. Directly means with the help of what is called just a cartilage known as the costal cartilage or hyaline cartilage. So anteriorly the ribs are connected to the chest bone, the sternum, by means of a cartilage, what is known as costal cartilage. It is being formed of hyaline cartilage. So costal cartilage is a type of hyaline cartilage. You know that when we have different types of cartilages, elastic cartilages, or they study in the case of tissues, hyaline cartilage and fibrocartilages. Now the type of cartilage found here is called hyaline cartilage, connecting the ribs to the sternum, hence called costal cartilages. Now we can classify the ribs into three types, two ribs, and then what is called the false ribs and also the floating ribs. The first 7 pairs of ribs are connected to the chest bone directly with the help of costal cartilage. They are called the true ribs. Now ribs number 8, 9 and 10. Ribs number 8, 9, 10. You can see now the 1, 2, 3, the numbers up to just what is called the 7. They are connected directly to the sternum with the help of costal cartilage. Now 8, 9 and 10. They are not connected directly to the sternum. Instead, they are connected directly to the cartilage of the 7th rib. And from where only they are connected indirectly to the sternum. So 8, 9 and 10 ribs are called, that is false ribs. They are connected to the cartilage of the 7th rib, and by which they are connected to the sternum. And then the last 2 pairs of ribs. Here I mentioned about, you see that on the 11th and 12th. These 2 ribs are not connected to, that is either to the previous ribs or to the sternum. They are connected only to the vertebral column, and they are called the floating ribs. They are not connected to the sternum, either directly or indirectly, but connected to, that is what's called the vertebral column dorsally. So we have 7 pairs of 2 ribs, 3 pairs of what is called the false ribs, and 2 pairs of what is called the floating ribs. Even the floating ribs are also called the false ribs because they are not connected directly to the sternum. Because they are floating, because they are not connected either, that is to the sternum or to the previous rib bones, they are called as the floating ribs. Then if you are taking the chest bone, so now this is a dagger shaped bone, a sword like bone, a dagger shaped bone, chest bone, what is called the sternum. It's being divided into upper manubrium. This is the upper part manubrium. The middle body and the lowermost body, what's called the sigmoid process. Normally we can say prosternum, mesosternum and metasternum. Pro, meso and meta. So pro is nothing but the manubrium. Meso is nothing but what is called the main body. And the metasternum is nothing but what is called the xiphoid process. A small projection, you can find it while touching your chest region. So that's about what we call the thoracic cage, formed of just 25 bones. Now the false ribs are called as, actually the true ribs are directly connected. The false ribs are also called vertebrochondral ribs. The meaning for that one, they are not connected to the sternum but connected to the cartilages of the previous ribs. That is what they call as vertebrochondral ribs. I mentioned about, that is false ribs. Now the breastbone I mentioned about, there is manubrium, the uppermost, that is called as the prosternum. Then mesosternum, there is nothing with the middle body, and the xiphoid process, the lowermost metasternum. So pro, meso and metasternum I given in the picture 2. We go through the picture for further analysis. Now the appendicular skeleton. So the appendicular skeleton includes the bones of the limbs and bones of the girdles. And we have, that's a limb skeleton, as well as what we call the girdle skeleton. The limb skeleton includes the upper limb skeleton and the lower limb skeleton. Now what do the bones constitute? The upper limb. Now this is the upper arm. Just we have in the picture. Now this is what is called the upper limb skeleton. So if you are placing this actually, now the pronation and supination position. Now this is what is called pronation and this is called supination. While placing the supination, just in position of this, what is called the hand, we can see the thumb is just actually facing towards outside. Thumb is facing towards outside, your picture also. And the little finger is facing towards the body. Now, the upper limb skeleton, you have nearly 30 bones in each. Number 1, humerus, this is 1, forming the upper arm. And then the forearm is formed of 2 bones, outer radius and inner ulna. This is the outer radius and inner ulna. Now the ulnar bone at its top has a process, what is called olecranon process. This is what we call the olecranon process. And that forms the elbow joint. What we have there, node-like structure, a swollen structure is nothing but the olecranon process. And that one forms what is called the elbow joint. Then we have the wrist region. The wrist is formed of 8 smaller bones, what are called the carpals, forming the wrist. Then the palm region, it is formed of 5 metacarpals. 5 metacarpals. One to each finger. Now we have the fingers. There are 5 fingers. Now the first finger is called as the thumb region. It is called pollex in the case of just arboreal animals. It is called the hallux, etc. Different names. Thumb. And it is being formed of, we see that one thumb is formed of 2 phalanges. The pieces of bones forming the digits are called phalanges. So it is being formed of 2 pieces. The remaining fingers are formed of 3 pieces of bones, what are called the phalanges. So the digital formula in the case of human beings, we have first 2 plus 3 plus 3 plus 3 plus 3. That is 14 phalanges forming what is called, that is the fingers. So only the thumb alone having 2 phalanges. The remaining 4 have just actually 3 phalanges each. Now the hind limb skeleton. Here too we have the hind limb is formed of 30 bones, the same arrangement. The strongest bone and the longest bone in the body, what we have actually the thigh bone, the femur bone, that is the thigh bone. It articulates with the pelvic girdle. And likewise the humerus articulates with what we have, the pelvic girdle. Now thigh bone, then we have a kneecap, what is called the patella. This is additional one. And this one a cup-shaped triangular bone covering the what is called the knee joint, anterior. Then we have what actually the shank region, tibia and fibula. The tibia is the strongest bone. It bears the whole weight of the body. And fibula is lying behind. So they are meeting what is called just the bone. Normally the tibia alone meeting, that is the femur, and the fibula is actually meeting only the upper part of the tibia bone. So shank bones, tibia, that is front, fibula inner, and angle bones are called the tarsals. So instead of 8 carpals as in, that is the wrist, here only 7 tarsals. That is being compensated by 1 loss, we have the kneecap. That's why we have the 30 bones. Now the angle bones, tarsals. The largest tarsal bone is forming the heel bone, that is called calcaneum. The whole body weight is being rested on this one, what is called the calcaneum, the strongest heel, the largest heel bone. Then the sole bones, instep region, having that is 5 metatarsals. And then we have the digits, as in the case of there is the fingers here, the toes have the same digital formula. The big toe has 2, the other toes have 3 phalanges each. 2, 3, 3, 3 and 3. That is totally we have 14 phalanges. Now here you can see just the head of femur, that is articulating with the cavity. I'll talk about later what is called acetabulum. And then what we have the knee, cap, patella. This is the head of fibula, you see that one. This is the fibula bone. And this is what we have the tibia. Tibia alone I mentioned already, forming a joint with femur, and the fibula head is in connection with only the tibia, not the fibula. So there are 7 tarsals, 5 metatarsals and 14 phalanges, and 2 for big toe. The remaining toes have 3 phalanges each. Now appendicular skeleton. We have 2 girdles, one is pectoral girdle, another one pelvic girdle. They are placed at right angles to the median axis of the body. Now the pectoral girdle is formed of 4 bones, 2 on either side. One bone is called the collar bone, the one which is actually in contact with, that is the sternum. Another end is in contact with what we have, that is the upper arm. And each half consists of 2 bones, what I mentioned. One is the clavicle forming the collarbone, and this is the collarbone. It is a long slender bone with the 2 curvatures. It is like what is called the bend. And scapula, it is in the form of a triangular structure, hence called the shoulder blade. So it is a large triangular and flat bone. It is triangular and flat bone, just normally situated on the dorsal part of the thorax between the 2nd and 7th ribs. Between the 2nd and 7th ribs. That is a location. So we have 12 thoracic ribs. It is located between the 2nd and 12th thoracic ribs. Now the dorsal flat triangular scapula has what is called a spine, a median spine. That is what is called slightly elevated ridge. This is called as a spine. You can find it very easily by touching the back. And this one is projects as a flat process towards what is called the outer end, that is known as the acromion process. So the clavicle articulates with this one here, and at the other end it articulates with what is called the sternum. And below the acromion process we have a cavity, a socket, what is known as a glenoid cavity. The head of the humerus articulates with the cavity formed by the scapula. The name of the cavity is called acetabulum. So that the head of the humerus and the cavity, the socket formed by, that is scapula, together from the ball and socket joint. The head of the humerus is acting as the ball. The cavity of the scapula is acting as what is called the cavity, and that is otherwise known as a socket or glenoid cavity. So this one forms the shoulder joint. This is what is called the shoulder joint. This is the pectoral girdle. Now it is being formed up, I mentioned about two bones. One is the clavicle, one end it is articulated with the acromion process. So it is nothing but the extension of the spine and then projecting out, that is nearby the cavity. So a triangular bone you can find is scapula, shoulder blade, the clavicle, the collarbone. One end it articulates with the acromion process formed by the scapula. Another end it articulates with the sternum. Now this is what we call the cavity. This cavity is called the glenoid cavity, lined with articular cartilage, nothing but hyaline cartilage. So the scapula forms a small projection just anteriorly, and that is called coracoid process. At the back you have, that is the extension of the spine forming what is called the acromion process. And anteriorly, just above the level of what is called the glenoid cavity, it forms what is called a coracoid process. So we have acromion process, coracoid process, the parts of the scapula or the shoulder blade. This is once again you see that one. That is the dorsal view. This is a spine which is extending as what is called the acromion process. And this is a cavity what is known as the acetabulum. Sorry, I made a mistake. There is a socket called the glenoid cavity. And other structures you can see now the spine, acromion process, and this one is a coracoid process formed anteriorly just above the level of the glenoid cavity. So anyway, the head of the humerus articulates with the glenoid cavity to form a structure, that is what's called ball and socket joint. Now the pelvic girdle, the one which is found in the pelvic region, the framework. So it consists of two coxae bones, or coxal bones. So during embryonic condition, each coxal bone is formed of three bones, but in adult it is formed of only one on either side. So each half of the pelvic girdle is called coxa. Each coxa is formed with the fusion of three bones, ilium, ischium and pubis. And the meeting of these three bones, at the junction of meeting of these three bones, there is again a cavity, as in the case of pectoral girdle, what's called acetabulum. This acetabulum is forming a place or providing a place for the head of the femur. So the head of the femur is ball-like, which fits into this acetabulum, forming a ball and a socket joint. Ball and socket joint. So this is shoulder. This is the shoulder joint. This is what is called the hip joint. So the hip joint is formed by what we have the acetabulum cavity of the pelvic girdle and the femur of what is called the lower limb. So glenoid cavity in the case of, that is pectoral girdle, and then just we have the acetabulum in the case of pelvic girdle. Now here is a diagrammatic one. So normally you know that what the pelvic girdle, it forms a joint with the sacrum forming iliosacral joint. Now this is sacrum, the terminal part we call the coccyx. So 5 plus 4, the vertebrae are fused together to form two plates. Now this is the vestige of what is called the tail region. Now this is what we call the ilium bone, and this is the pubic bone and the ischium. Now the two pubic bones are joined anteriorly by means of pubic symphysis. Pubic symphysis. That is nothing but a kind of what's called fibrous cartilage. A fibrous cartilage joined together by means of fibrous cartilage. So we can see the joints later. What are the types of fibrous joints? Then we have cartilaginous joints, and then we have synovial joints. So here the pubic symphysis is formed by what is called the fibrous cartilage joining the two. That is called pubic symphysis. Now this is what is called the ischial bones with a small foramen, obturated foramen. That is called obturated foramen. There is a foramen, a large opening present in the ischial region. So all these bones meet together, and at the point of meeting you can see what is called the acetabulum. This is the cavity. into which the head of the femur fits. All these things, some of you studied in your 9th standard, I think so. So let's go far. Now pubic symphysis, what I mentioned, the two halves of the pelvic girdle meet ventrally to form the pubic symphysis containing fibrous cartilage. That means the two bones are joined together by means of fibrous cartilage. That is called the pubic symphysis. Joints. So what do you mean by joints? The place where two or more bones meet is called as a joint. The place where two or more bones meet is called as a joint. So we have different types of joints. Generally speaking, 3 different types of joints. You see that one, joints are points of contact between the bones or between bones and cartilages. The joint being formed either between bones and or between bone and a cartilage. Now the study of joint is called arthrology. And you know that when any disease in the joint is called arthritis, inflammation of the joint is called arthritis. The study of joints is called arthrology. Now there are 3 different types of joints based on the movement. Some joints are highly immovable. Some joints are slightly movable. And some joints are actually more movable. And those joints which are highly movable are called those joints which are not movable are called immobile joints. And normally they are called as fixed joints, as they are all fixed by the fibrous cartilage. They are called fibrous joints, otherwise called synarthrosis technically. So one fibrous joint, they are immovable joints, they never move. They are joining the bones, not allowing the bones to move. And such a type of joint is called what is known as synarthrosis. The next one is slightly movable joints. They are called as amphioarthrosis. The joint is made by means of cartilage bones. There you have the fibrous, dense fibrous tissue or fibrous cartilage as between, for example, the disc between the 2 vertebrae. That is a joint there. So, either by means of fibrous cartilage or by means of hyaline cartilage, we have just here the dense fibrous tissues connect the 2 bones. That's why the bones do not move. They are called synarthrosis. And the bones are slightly movable. In some cases, they are called actually slightly movable joints, otherwise called as amphioarthrosis. And those bones which are highly movable are called normally, that is diarthrosis. So we have synarthrosis, immobile joints, or amphioarthrosis, slightly mobile joints, or we have what is called just more mobile joints or highly mobile joints, or simply we can say mobile joints. They are called diarthrosis. So synarthrosis, amphioarthrosis, and diarthrosis. Now fibrous joints or immobile joints are fixed joints. An example you see that one between the cranial bones which are joined together by means of fibrous cartilage. Now these joints do not allow any movements due to the presence of strong and dense fibrous connective tissue. Not fibrous, dense fibrous connective tissue. What we have just like ligaments and tendons. Here a dense fibrous connective tissue joins the bones. For example, the zigzag lines in the case of cranial bones are the joints which are joined together by means of dense fibrous connective tissue. I have given the example joints between the flat bone of cranium in the form of sutures. The sutures are nothing but immobile joints. The joints are actually formed or fused. The 2 bones are fused together with the help of fibrous, what is called connective tissue. A dense fibrous connective tissue, not loose fibrous connective tissue, a dense fibrous connective tissue. Now the second one, cartilaginous joints or slightly mobile joints. You see that one here, the bones involved are joined together with the help of cartilages. There we have dense fibrous connective tissue, here with the help of cartilages. This type of joint allows limited movement. Example, you see that one joint between the 2 adjacent vertebrae, that's in the form of intervertebral disc, and joint between the sternum and the ribs. That also actually shows movement, sternum and the ribs. That also join at the symphysis pubis or pubic symphysis. The 2 pubic bones are the pelvic girdle. Then that is actually the joint between the 2 adjacent vertebrae, or the joint between the clavicle and the sternum. So clavicle and sternum is an example for what is called amphioarthrosis, the joint. Or we can say, for example, between the adjacent vertebrae or in the pubic symphysis in the pelvic girdle. All are examples for slightly movable joints or amphioarthrosis. And the last one, you see that one types of joints found in the human body generally. We can go also what we have the synovial joint or what is called diarthrosis. Now these are all cartilaginous joints, the joints between the successive vertebrae. See that one in the form of intervertebral disc. Now these are all the fibrous joint, these are all the sutures. There you have the fibrous connective tissue in the form of dense fibrous connective tissue. And then just movable or synovial joint, the elbow joint or we have the hip joint, they are movable joints. We'll see. Now the third type, what we can say, the synovial joint or movable joint. So these joints are always called perfect joints because they allow the movement of the bones in all directions. Now these joints are characterized by, if you have just actually, I'll show the picture. Now this is what we get the synovial joint. These are the two bones, bone number 1 and bone number 2. And their tips are actually covered by means of cartilage, what is called articular cartilage in the form of hyaline cartilage. They prevent the friction while the bones are actually moving. And normally the two bones or the joint is enclosed in a cavity, what is called synovial cavity. That synovial cavity is filled with, you see that one, this is the synovial cavity. The synovial cavity is filled with a fluid, what is called the synovial fluid, a kind of just actually a polysaccharide containing different components, acting as a lubricant while the bone is normally moving. So we have, you see that one, just actually synovial cavity filled with synovial fluid, which is covered by a membrane, what is called synovial membrane, and over which there is another capsule to protect the synovial membrane, that is what is called fibrous capsule. So from outer to inner, fibrous capsule, synovial membrane, synovial cavity, articular cartilage in the form of what we have actually, that's hyaline cartilage, all being present. So there are different types of synovial cavity, synovial joint, based on the degree of movement. So let's see now one by one. In what way? They allow either in one direction of movement or in many directions like that. Now types of synovial joints. So there are different types of joints depending upon the nature of articulation, how far they are articulating with one another and how far they are allowing the movement. So nature of articulation and the degree of movement, whether they are allowing only just a certain degree or in just actually allowing movement in high degree, etc. Now ball and socket joint. Here one bone is acting, the one bone head is acting as a ball, whereas another bone is having a cavity, what's called the socket, so that the ball of one bone fits into the cavity, so that we have ball and socket joint. Now we have what is called the shoulder joint, the hip joint, examples for what is known as ball and socket joint. Now hinge joint. So this one allows movement only in one direction. You see that one allows movement only in one direction or in one plane. See here the elbow joint allows the flexing arms, not allow the movement in backward direction. So the knee joint is an example for hinge joint and allows the movement only in one plane. Now pivot joint. Here one of the bone is acting as a pivot which is being fixed, for example the axis. The second vertebra is fixed over which what is called the atlas is moving. So the axis bone is acting as a pivot on which another bone is moving. That is why you see that one. So one of the two bones is fixed in its place. That is, for example, the axis bone, and bears a peg-like structure, what is known as a odontoid process. And over this odontoid process, now rotate another bone. So the rotation, so it is being placed over it. And that is between atlas and axis, an example for pivot joint. One bone is fixed and then another one is having a peg-like structure. As in the case of seesaw, you know that one there is a peg over which a plate is moving. In that manner also here there is a peg provided by odontoid process of the axis bone on which, see that one, the atlas is rotating. Now gliding joint. Here the bone, one bone is gliding over another. You see that when the joint permits sliding or gliding up articulating bones on each other. Now the joint between the carpals, the joint between the radius and ulna, the joints between what we get the clavicle and sternum. These are all examples. So the clavicle and sternum, the clavicle is sliding over sternum. Now likewise, you see that when the radius ulna while rotating the arm, just sliding over one another, and also the carpal bones also sliding over one another. They are called as gliding joints. Saddle joint. So they're all actually similar to the ball and socket joint, but the ball and socket are poorly developed. So it allows bone with a convex head to move in many directions. Now joint between the metacarpal. Now this is the thumb region. Here it is metacarpal. The metacarpal normally just joins with what is called the carpals against the thumb region. This is an example for saddle joint. Here we have some projection of the bones in the metacarpals. We have some cavities in the what is called the wrist bones. So the saddle joint is seen between the metacarpal and carpals of the thumb. Metacarpal and carpals of the thumb. Just below the thumb region we have one metacarpal. It forms a joint with what we call the carpal, and that is called the saddle joint. And another one, angular ellipsoidal joint, just like angular ellipsoid in nature. Now the wrist joints also sometimes allows direction all. It allows actually the movement in all directions. So though the wrist bones are an example for sliding joint, they are also an example for angular ellipsoidal joints. So because allows movement in two directions, either this direction or this direction. So like that they are called as actually the angular ellipsoidal joint. It is only rare. We can describe only just a sliding joint for the wrist bones. Rarely we can also use the word angular ellipsoidal joint for, that is what's called the wrist bones. But the wrist bones are mainly for the sliding joint, otherwise called the gliding joint. Now types of synovial joints. Now we have the pivot joint between the atlas and axis, the ball and socket joint between what we have just actually this one, the shoulder joint, and also the hip joint. And then we have the hinge joint, the elbow joint, and then ellipsoid joint just we have in the wrist bones. The saddle joint present only just below the thumb region, the metacarpal and the carpals form a joint. And then the gliding joint, once again you see that one, the tarsal bones also example for gliding joint. We have the tarsal bones in the foot and also the carpal bones in the wrist region. So these are all the different types of joints. Now let's see some of the disorders related to a few words as per the NCERT syllabus. Now one disorder related to the skeletal system, arthritis. The word arthritis refers to the inflammation of the joints. We have a number of actually arthritis. One, infective arthritis caused because of the infection of bacteria or viruses or the fungus or helminthic worms. That is called infective arthritis. Then rheumatoid arthritis, it is an example for autoimmune disease. It is being caused against antibodies produced by an unknown antigen. Here the inflammation of the synovial membrane occurs because of the antibody produced against an unknown antigen. That is called rheumatoid arthritis. Then osteoarthritis or osteoarthrosis, it is a one which is normally developing progressively in the case of people who are attaining age. So when the person is attaining old age, there is an erosion of the hyaline cartilage, so that what we have the pain in the joints occur. So it is because of the degeneration of the articular cartilage or the hyaline cartilage. That is called osteoarthritis or osteoarthrosis. Actually it is happening progressively, not occurs all of a sudden. It is not caused either because of infection or by means of autoimmune disease. It is because of old age, because of the erosion of the hyaline cartilage. The last one is a kind of metabolic arthritis. It is due to, that is a metabolic disorder. Now, we have the purines in the nucleic acids, adenine and guanine. And these are all undergoing what is called actually, that is degeneration process to form the waste products like uric acid. So uric acid is a product of metabolism of purines, namely adenine and guanine. So normally the uric acid is eliminated through urine. Sometimes, occasionally what is happening? The uric acid gets actually accumulated in the synovial cavity, in the form of sodium urate salts. Either just actually accumulated on the surface of the hyaline cartilage or on the surface of the synovial membrane. So anywhere else it accumulates in the joints, causing a metabolic disorder that is called metabolic arthritis. It is otherwise called gout disease. So the gout disease is caused because of mainly, that is uric acid metabolism. A defect in uric acid metabolism leads to, that is the accumulation of uric acid in the form of sodium urate crystals deposited on the articular cartilage as well as the synovial membrane, causing the inflammation leading to leading to what's called the gout. So it is an example for metabolic arthritis. It is due to the abnormal metabolism of purine like adenine and guanine. Now also, these are all just actually the previous ones we have studied something related. And these are all arthritis caused by means of different reasons. Now osteoporosis. So here after a certain age, in the case of female, the mineral density decreases, leading to the porosity of the bone. The bones becomes porous because of the loss of the calcium, and that occurs possibly in the case of female after the age of 40 or attaining at the age of menopause. This is because of decrease in concentration of the female sex hormone estrogen that causes the removal of calcium from that one, leading to the porosity of the bones. The mineral bone density decreases, that results in osteoporosis. This is because of decreased level of estrogen, the female sex hormone in the case of female. Now osteopetrosis. Sometimes what is happening, abnormally dense bones. The previous one, the density decreases. Some cases normally what is called the density increases. That is called osteopetrosis. It's a hereditary disease. Then osteitis. Any word ending with TAS suffix referring to the inflammation, arthritis, TAS, appendicitis, endocarditis, nephritis, all words ending with the suffix TIS referring to the inflammation. And here osteitis, nothing but the inflammation of the bone. Okay, then osteomyelitis. This is also the inflammation of the bone, but refers to what is called the bone marrow infection, osteomyelitis. Sometimes we have what is called myeloma disease. A genetic disorder happens. So osteomyelitis is nothing but the infection of the bones, or we can say the infection of the bone marrow or the inflammation of the bone marrow. So these are all the disorders related to, that is, arthritis. So what are the disorders related to the muscular system? The one responsible for the movement along with the skeletal system. Tetany, you know that one. It is because of hypoparathyroidism. When the level of parathyroid hormone falls below, because of the degeneration of the parathyroid gland. Now what is happening? Tetany occurs. This is because of the decreased calcium level in the blood. So, which results in rapid contractions of the muscles, or rapid twitching of the muscles and tightening of the muscles. And that is called spasm, tightening of the muscles. And this is one of the reasons I mentioned, that is the calcium level decreases in the blood. That condition is called hypocalcemia. Decrease in calcium level in the blood is one of the reasons for the development of tetany and hypercalcemia in the body fluid, particularly in the blood. So it is due to hypoparathyroidism, decreased level of what is called parathormone or the degeneration of the parathyroid. Now myasthenia gravis, another autoimmune disease. Here the muscles related to what is called actually the respiration, talking, walking, all being affected. So autoimmune disorder affecting neuromuscular, particularly the junction. Now at the neuromuscular junction, there is a failure of conduction of nerve impulses. Now the junction between the neuron and the muscle, I mentioned about neuromuscular junction. And normally at this junction only the acetylcholine is released to just create action potential. And here what is happening, the neuromuscular junction fails to conduct the nerve impulses to the muscle, so that the muscles related to walking, talking, just chewing, all being affected. Even we have the drooping of eyelids. Once the eyelid has fallen and it never goes back, that is one of the major symptoms. What is the reason normally here? In this case, the acetylcholine activation channel by means of calcium ions. So calcium ions are responsible for activating the acetylcholine. That is mainly calcium ion is responsible. That is the one which is responsible for the breakdown of the vesicles to release the acetylcholine. So acetylcholine activation channels are affected because of what we have this disorder, due to failure in the transmission of impulses at the neuromuscular junction. And now, actually, what is the reason for that one? This is because of the thymus gland. The thymus gland develops certain antibodies which will affect what is called the neuromuscular, which will affect the activation of acetylcholine channel. That results in what we call the myasthenia gravis, a muscular disease. What are the symptoms? Fatigue, the tiredness, weakening and paralysis of the skeletal muscles, drooping eyelids. The eyelids have fallen, they never go back during contraction. The muscular dystrophy, a kind of genetic disorder, You have different types of muscular dystrophy. It is a recessive X-linked digit disorder. So affecting the muscles so that the person is unable to walk. Affects the muscles, particularly the thigh muscles. They need mainly what is called the wheelchair for the movement. So it is due to recessive X-linked digit disorder. Progressive degeneration of the skeletal muscles, particularly not at the adult age, at the early age. Inability to walk after the age of 12. It occurs during the early age, affecting the thigh muscles particularly, so that the child is unable to walk after the age of 12. So these are all some of the things related to the locomotion movement, just what I completed. Okay, so go through this, the questions and also the topics related to the NCERT. So with that I concluded, it is locomotion and the movement.